in the oral cavity, you have good bacteria and you have bad bacteria. Okay. And Alzheimer's, Parkinson's, all of these diseases, and even heart disease, we're linking it with the oral cavity. It can cause so many other diseases. So because it's all linked. Other day, just I think a month ago or a month and a half ago, I had a patient who had unfortunately an open heart surgery just because his root canal wasn't done properly.
Hello and welcome. Today we have Angel with us.
Yes, hello. Thank you for having me.
Yeah, thank you for making time for this with your crazy schedule.
Yeah.
Angel, you are a dentist?
Yes, I am.
Dental hygienist?
No, I'm a dentist, a general dentist and an aesthetic dentist. And I'm also doing Invisalign.
What is that?
It straightens your teeth. You wear aligners and then you get your teeth straight if they're crooked or they have spaces.
Okay, so fixing them in line.
Yeah,
okay.
But I just do dental hygiene along with, the rest.
Oh, okay, cool. How did you get to do that? How was it your child dream or how you...
No, not at all, actually. Thing is, at the very beginning, I always wanted to be a healthcare professional, especially a doctor, a general doctor. But when I went to the university just to check out the programs, I felt that I've always appreciated art. So when I went there and I saw the different programs, I saw that there's a lot of skills labs. Mm-hmm. And I said, the first year is foundation, so you get to choose. And then after that, I said, okay, let me just give this a shot because I like to, be a bit creative. And so, yeah. And then ever since then, I just carried on with dentistry. So it wasn't my first choice, but yeah.
So you merged art?
Yes.
Oh, have you been interested in art as
well? I've always been interested in art, yeah.
Okay, so that's why you were asking about the paintings as well, yeah? Do you paint or do some other art?
No, I don't have any more time to do that, unfortunately. But I used to, when I was younger. Mm-hmm. But at the same time,
just move your mic a little bit. More.
Sure, no worries.
Yeah,
okay.
Way better.
Yeah, okay.
Cool. So no more art, just teeth.
Yeah, teeth, but teeth itself is an art. So every day I'm doing art.
Okay. Yeah. Well, that's a very interesting way of looking at it. Mm-hmm. When, we are a little bit limited on the time today.
No worries.
So we will go question and answers, and I'll shoot and
go
you
ahead
shoot
and
back.
shoot.
Okay?
Yeah, I'll shoot back.
What would you say is the ideal step-by-step procedure for people to take care of their teeth on a daily basis?
Okay, so basically, I think everyone knows this, but everyone thinks it's 3 times a day. Usually 2 times a day is more than sufficient. First in the morning and then at nighttime. When they brush their teeth, it should be more than enough. But more important than that is coming in and visiting the dentist every 6 months. So biannually, it is very important because sometimes a toothbrush doesn't reach in those difficult areas, especially in the front area. So remember, last time when I was explaining to you, in our saliva, we have lots of calcium, and the calcium, it just deposits into calculus, and that stays stuck, around, especially in front of, on our front teeth at the back. So that's a very hard area to get access with a toothbrush alone or floss. So that's why it needs to be professionally cleaned. And this, plaque deposits that gets transferred to calculus, it basically what it does is when it stagnates there for a very long time, the gums start going down, they start receding, and at the same time, we as humans, we barely have any bone here, so it's very thin. Mm-hmm. So that is all the support our teeth has. So if the calculus starts eating up, it is a big problem. So that's why we advise every 6 months. And
can you explain a little bit more what is the calculus?
So calculus is plaque. It's the thing. It's the layer that goes onto your teeth. Okay, it's filled with bacteria, but it hardens. So it becomes calculus because of the calcium that's in our saliva.
Okay.
Yeah.
So is that a stone structure that you were brushing off?
Exactly. It was those stones. Exactly.
Those stones. Okay. And then when it goes under the gum?
Yes, when it goes under the gum, there's like constant bleeding. So that area of the calculus is black. And when it's on top of the gum, it is white. So that's why last time when I showed it to you, it's like half black, half white. Mm-hmm. Okay, so this is very detrimental to the oral health. The bacteria seeps through inside the gums. It brings it down. And at the same time, it's eating up the bone. It's letting the bone line recede down and causing bone loss. Mm-hmm. Yeah.
Okay, and when we would think about that, you think twice a day is fine? However, every 6
months, yes. And for there's many patients who've had braces before. So after they have braces, we always advise them that they need to have a fixed lingual retainer, which is a wire so that the teeth don't move back to their original position. But because of that wire, patients cannot floss. It is very difficult. Okay.
I had that.
Yes, exactly. So because of this, that's why they have to come in every 3 months rather than 6 months, so that we can get it out.
Is it true that if you have these, or I don't know how it's now, maybe the technology moved on, but maybe 10, 20 years ago, and maybe even now, when you have these correctors in your mouth, like, so it's straightening your teeth. I don't know the
aligners, yes.
Aligners, cool. The aligners. Is it changing the pH of the saliva?
Well, no. Your pH stays the same. Okay. It will only change the pH if, like, you're not brushing your teeth or you're not cleaning your aligners. Because obviously the bacteria will turn into acidic.
Because I was told before that I start to have a lot of problems with my teeth after I finished with the braces. Okay. And they told me that because it was a lot of metal in the mouth that changed the pH of the saliva.
Okay, so that's a different one. What we're doing, so usually now there still is orthodontic treatment, which is the one with the metals and the wires and the brackets.
Yeah, that's
the one that you had. Yeah, but nowadays we don't really go into the conventional orthodontics unless it's like extremely necessary. One of those reasons is because they created Invisalign, which is invisible aligners. It's a clear piece of plastic that patients find a lot more convenient. They can eat whatever they want. They can drink whatever they want. They don't have to go to the orthodontist every, let's say, once a week so that the orthodontist can tighten up the forces. So this is what the aligner does. So all the patient needs to do is change the aligners, let's say every 10 days to 2 weeks. So the aligner is the orthodontist changing the forces.
Okay.
Yes. So I know that it sounds really extreme. How does a piece of plastic change your teeth? It does. And I can show you pictures maybe later on. But it is basically an algorithm on the computer where we take your teeth model. Okay. And we show you your pictures before and we show you your pictures after. And it will show you how the teeth will move. So on these aligners, we have attachments on the teeth. And so each aligner has a different movement. Okay. So this is how we're moving the teeth gradually. And it's a lot faster than the conventional one. So that's why I'm saying the pH is the same. Plus, why did you say that they ruined your teeth? So most of the time it is very difficult to brush your teeth when you have brackets and wires all over. It's kind of impossible. You'd have to buy special brushes, stuff that can go underneath the wire, around the brackets. So this is something I always see on young adults where they have this white circle around the bracket after they remove it. This is the initiation of caries. Caries means cavities. But then your saliva remineralized it, so that's why it doesn't look nice. So with Invisalign, you don't really have this problem because with Invisalign, it doesn't have those attachments with the metal brackets. And you can easily brush. For example, if you wanted to have chicken or even popcorn, it is very difficult to have it with your normal braces. Yes. I'm sure that you remember.
It was terrible.
Yeah, exactly.
And the white marks you said?
Yeah, the white marks.
It wasn't there for a long time, but I had it there as well.
And then gradually it started to remineralize. Unfortunately for other patients as well and other people, it stays there for good.
Oh, wow.
Yeah, so they look for aesthetic alternatives and yeah.
And these plastic ones?
Yes.
How do you call it?
Aligners. The first ones who invented it were Invisalign.
Oh, okay, Invisalign.
Yes.
So those, it's also like permanent, like you have it there all the time?
No, you can remove it. So for example, if you want to go have like, a drink, like let's say coffee, or you want to have something to eat, like a salad, you just remove it and you put it in its container and you eat. Then you just brush your teeth and then just put it back on.
Okay, so you can, for example, have it also only at night, for example.
No, so on average, for it to work, you need to be wearing it, let's say, 20 to 22 hours a day.
Oh, all right.
So let's say you have 2 to 4 hours to spare to eat, like your breakfast, lunch, and dinner, which I think is like, more than enough.
Yeah, but still better than they just put 2 kilos of metal in your mouth, as they did to me. Yeah. And Tima, you had questions?
Yes, but not the braces related.
No worries, go ahead.
Like if you can get the same result with cleaning the teeth with a normal brush, or like what is the difference between normal toothbrush and the sonic
and then
one.
For example, like
or if you can get the same result even if you are like really polite proper with it.
So there is a difference between the two. You have the electric toothbrush and you have the manual toothbrush. Now, I personally, I love the manual toothbrush. I don't like, especially for kids, I like the kids to learn the dexterity. Like I believe kids should know how to use their hands, how to brush, of course, with their parents' supervision. Yeah. However, with the electric toothbrush, they've added so many features for the safety of the patients, where let's say, there's like this Oral-B toothbrush and then you have the Panasonic one. Let's say on the Oral-B one, it has like this pressure sensor, so that when you're brushing your teeth, you're not applying too much pressure. So, and the same thing, you could be as detrimental to your to your gums as well and to your teeth if you're using a manual toothbrush and you're like aggressively brushing.
That's what happened to you, right? They told you that you were doing it too much.
Yeah, like I'm brushing too much, but I never had like split it these ends, and Paolo, he is always like
it's like perfect.
No,
mine is perfect. He's not, but they said to me that I'm brushing too much because of the
gums receding. Yes, they're going up for the upper teeth and they're going down for the lower, which causes sensitivity later. Yes. So this is why, like, for example, when I see that, some patients are like, super aggressive with the way that they're brushing, I ask them, okay, please switch to an electric toothbrush, at least it has a sensor. And then you're not applying too much pressure as well. Yeah.
I just want to get back to the thing you were saying before about that algorithm.
Yes.
So you have the starting point, then you know what is the end point, right? Because that's the teeth being straight. But this algorithm, it can tell you exactly like, okay, in this week we'll move this much. In following week we'll
That's correct, yes.
Oh, that's great.
Yes. So Invisalign, basically they've treated around 11 million smiles worldwide. They're the ones who originally created this innovation. It was like, created for people who are like on the go. So many people who are always traveling. So many patients who find it very inconvenient to go to the orthodontist every week. It was created for us basically. Like this is something that everybody requests, and with this algorithm. So how does it work? A patient comes in, to the clinic, and we take their photos, we upload it on the application, and we also take their impressions or a scan of their teeth. Then we send it off to the United States, and over there's a whole team of technicians who are forming this algorithm to show you your before and end results. So, for example, I do the treatment plan. I ask my patients, what is it that you do not like about your teeth? What do you feel like we can correct? Okay. And I see it and I tell them what I think. And then we merge the two together. And then we ask the technicians and myself, and the Invisalign team, what we do is we design that treatment plan. So when we design this treatment plan, of course, there's an algorithm to it and it moves it. So let's say on average, the aligner will move it, each aligner, let's say it's from 10 days to 2 weeks. It will move around, let's say 1 degree for a rotation. It will move
It can also rotate.
It can rotate. It can, pull up, it can push down, it can move to the right, it can move to the left, it can it moves bone, it moves teeth. So, the transformations are amazing. It's like, like till today, I think it's remarkable, even though I've been doing it for a few years now, but it's something that I'm like, oh, wow, this works. Like,
This is so cool.
Oh, this is so cool. Yeah. I'm always so fascinated by it because of how fast, like on average patients start seeing, like, let's say they start seeing results within 4 months. Even though the treatment, let's say on average takes 8 months to a year and a half, 2 years. Of course, you have more complex cases which can take more. However, this is the average.
Is it true that the jaw is smaller and weaker than it was before?
Like back in the days? Yes, of course. So let's say way back when humans first, like, existed, we all believe that, human beings were a lot bigger in size, like not just the jaw. Like, for example, if you go through archaeological documentaries, let's say, the doors, everything was way bigger than what it was. I mean, what it is right now. Humans were bigger. Their bones were stronger. So, like, if they were taller, obviously their jaws were also bigger. And in fact, they say that the wisdom tooth was not the last tooth. So if they find, like, these, like, let's say these skeletons with the jaws there, you would see that you have more teeth. Mm-hmm. At the back. So that's why when we're evolving as humans, so now we get many patients who either have congenitally missing teeth, meaning it just doesn't exist in the first place, especially for the wisdom teeth. And you have some people who have, like, for example, the 2 wisdom teeth and the 2 other teeth, they're not there. And then you have other humans, like, they have all 4 wisdom teeth that they probably need to remove because it's not coming out in the correct way.
I have all of them.
You have all of them, yeah. For example, I have one that's congenitally missing.
Uh-huh.
Yeah. So I had to remove 2. One is stuck up and the other one is just not there.
I had very interesting case.
Yeah.
And I was reading onto this, and now you can confirm if it's correct or not. Well, when they were doing my correction to put it all in line, they had to pull out 4 of them.
Yeah.
Each side, basically top left, top right, bottom left, bottom right. They removed 4 teeth because they said that I have too small mouth.
Yes.
For too many teeth. And that's why I had almost like a shark, like 2 rows, like it was just all over the place. And I was reading on it, and there is an explanation from one doctor who I can't remember the name. He's some Harvard professor of anthropology, and he said that it's because we are not loading the jaw enough with chewing hard stuff from when we are born.
Yeah.
Because the mechanical impact, if it's there, like chewing to roots and leaves and what our predecessors used to do, like it would actually allow us to develop bigger jaw, bigger mouth, and then I would not have that problem. Is that correct?
So this is all, the way how everything happens. It is the formation, of course. So I do believe in that as well. I don't know all the specifics, of course, because this goes into the anthropology sector. However, it does make a lot of sense because everything that we do has an impact. Like obviously, let's say you go to the gym, you work on your muscles grow, correct? Same thing.
We like to hope that. Yeah.
Yes, okay. So the same thing. Our jaws, all around it, you have muscles. You have the masseter muscle, you have the buccinator muscle, and of course our types of food are different. Okay? So like, let's say what you were mentioning earlier, the types of food that, humans used to have. For example, they were more like, these carnivores, let's say. They used to eat a lot of raw meats, bones even. So this is something that, they had to use the masseter muscle, the buccinator muscle. And obviously, like whatever you do, the mouth, it grows. Like for example, let's give you a really common example where there's thumb sucking in children. Okay, so it's a simple act. They just put their thumb inside and they do the thumb sucking, right? So because of that, it changes the shape of the vault, the palatal vault of your mouth.
The ceiling.
Yes, the ceiling. It changes that. It changes the way your teeth are oriented. It actually makes an open bite. And it changes the way your jaws are together. Like, for example, usually what will happen is you will see that there is an open window in between your teeth. The jaws don't close in completely. The child develops an open bite. Okay, so I understand where that's coming from, because even if, like, you know, you're not eating and then there's the you know, the common habit of children sucking their thumb, this alone is doing something. Or, for example, the pacifier. So yeah, it's all changing the shape. Yes, exactly. It's all changing the shape of your jaw. It's changing the shape of your mouth. So of course I'm with this 100%. Yeah.
So do you think it's good to do like kind of strength work for the jaw?
Well, of course it is. But like, for example, I've been noticing a lot in the clinic lately, especially in today's world, everybody is under stress. Okay, whatever their field is, even if they're students, they have exams. I always like, you know, it always, I can see it on a day-to-day basis that patients, they clench. They have something called bruxism. And like, let's say at the gym, a lot of people who go to the gym, all they do is like they clench when they want to hold weights, and they just do this to their teeth. So because of this, this is really making this area very muscular. So that's why they get this beautiful thing called the Texas jawline. Like, you know, I myself, I am a clencher, and then we have like really nice jawlines, you know, what people go in to do fillers to make this really nice line, you know, but yeah, that's what we have it naturally, because we're like clenching all the way, you know. I remember when I was in university, especially during exams, I used to, like, you know, of course, inevitably I would be stressing. So this is something where I thought that I would wake up every single day with a headache. And I didn't know what it was. So I went to a hospital, like to like a normal general practitioner, and I told them that, you know, I have a headache. And they're like, oh, hey, let's take for you an MRI. Maybe you have like a tumor, just to rule this out. Yeah, exactly. It sounds a bit extreme, I know. But I'm like, okay, sure. Why not? I mean, I'll just check it, not an issue. And then I went to several, they didn't know what I have. And then I went to one of my professors. Back then I was 23 at the time. And he told me, okay, nothing shows in your mouth, but I think you're stressing due to exams, which is why you're clenching at night. And then I started noticing that when I wake up in the morning, my jaws are like kind of glued together. And I feel that stress and tension, and then my headache was over here, like, you know, like on top of from that
so
area.
So you created pressure on your skull bone.
Exactly.
For clenching the
and
teeth.
Yeah, so it extends from here to the temporalis. Exactly. So this is a common thing that I see daily. It could be teenagers, it could be young adults, it could be people who fly a lot, lots of cabin crew, especially pilots, people whose circadian rhythm is destroyed. I see it on a day-to-day basis. So when you say that practicing how to move our muscles, oh, trust me, we're practicing so much that we are wearing off our teeth. Yeah. So like the prevention for this, till today, this is something that's very multifactorial, meaning there is not one certain cause. It could be due to a multitude of things. It could be due to your bite. It could be due to genetics, like let's pretend your parents have it. It could be due to the malalignment of teeth. It could be due to so many things. So this is why we want to do prevention, so that we don't wear off the tooth surface and we don't cause receding gums as well. So this is something that, you know, because of that constant unnatural force, this is what affects us. And this is how we lose bone on the front teeth. It's not just due to calculus, by the way. So it's due that you lose gums not just because of aggressive brushing techniques. You lose gums because as you get a receding gum line, because you're constantly doing, either you do bruxism, meaning you do this like that, or you just clench and then you hold while you're sleeping. So this is all parafunctional habits. This is all not natural. You know, this is not what the human body is designed to do. But the human body, when you're sleeping at night time, you're sleeping to a point where your subconscious mind is telling you that, hey, this tooth is out. It's not properly aligned. Let's shave it a little bit.
Oh,
okay. So this is exactly why this bruxism kind of happens.
So you're giving yourself your own treatment.
Your own treatment while you're sleeping at night.
Oh, wow.
So smart.
Yeah. Okay. So this is over the years, they started to figure these things out. So that's why they don't give you one root cause. Mm-hmm. This is why it's multifactorial. So for example, you have patients who have perfect alignment of teeth, but due to genetics, they're grinding their teeth away. Mm-hmm. Or due to the fact that their job is so stressful or their life is so stressful that there is something, they have to do, Yeah.
I heard that mouth breathers,
yes.
So people who breathe through the mouth more, they tend to grind their teeth as well.
Yes, they tend to grind their teeth, yes.
So taping the mouth for a night will help.
Of course, it is one of the treatments. These like, for example, these mouth tapes, you can get them at the pharmacies. And
even on Amazon now.
Even on Amazon now, exactly. And now there's also another thing that we give as dentists. It is night guards. Yeah. So we give these night guards just like the sports guards when people are exercising, but it's a bit different. It's soft on the inside where it's fitting the teeth, and on the outside it's very hard. Because see, if it was very soft, your body will naturally want to clench more because it's cushiony. You need something hard. So
it's inside.
You put it, yes, you only wear one.
Okay. I thought it's that thing, you have like a strap around your chin.
No.
And you put it on top of head and tighten so your mouth is closed. No. I've seen that as well. So.
Yeah, but that's basically for orthodontic intervention, especially for kids. Mm-hmm. If there's a jaw issue or a skeletal issue, so they want to push back the gums using external forces. Mm-hmm. Okay, but regarding the night guard, you only wear one, and it will take on average 2 to 3 weeks for a patient to get used to it. Because first thing you'll find it, including myself, you'll find it on the bed sheets, you'll find it on the carpet. You're like, what is this? And you just throw it out. But at the end, you get used to it, and it's really, really, really helpful. However, it is not a treatment; it is just a prevention. So when you grind on the teeth, you're ruining the teeth, but when you grind on the plastic, you're just ruining the plastic. So what you did is you redistributed the force onto the plastic rather than your teeth, gums, and bone.
So it's fixed, but it's not going to treat the root cause.
Exactly.
Do you use it?
I do, yes.
Like every night?
For me, I noticed that for myself, it is only induced when I used to have exams.
Okay.
Right now, I'm living a stress-free life, but don't really have these. Yeah. So it's all good. It's all good. Yeah. So basically, mine was due to it was stress-induced. Mm-hmm. Other people, for example, I have my sister. She has a deep bite. She cannot sleep without wearing a retainer or her Invisalign. Otherwise, she will try to put her cheek here and here just to bite it so that she releases that pressure from her teeth. And I see it a lot on anybody who has a deep bite.
Biting her cheek?
Yes. She puts
her own cheek from the inside?
Yes, just so that she releases it. And a lot of class 2 patients do that as well, where they have, it's a deep bite, where the upper jaw completely closes on the lower jaw. Mm-hmm. So this is something that is very, very, very common. Mm-hmm. Yeah.
When you're meeting people, we are sitting here and talking, do you assess constantly? Okay, so this is the problem, this is the, immediately looking at the teeth, looking at the jaw, and analyzing people around you?
I kind of do notice.
We have it as me as a coach team, as a physio, I immediately look at the shoulders, tension, and I'm always,
So the first thing, naturally, the first thing I will notice is someone's smile. And, it tells a lot. You can tell whether a person has, let's say, you could rule out whether the person has diabetes just by looking at someone's teeth. If there's a lot of bone loss, you can tell that person probably does have diabetes, or probably is on the verge of getting diabetes. Okay, because everything is playing a role. We can see so many things. We can tell, if a patient is a smoker or not. If a patient is a smoker, not just will the stains tell us, but as well as the bone loss, because the nicotine, what it does, it basically constricts all the capillaries, and your bone supply doesn't get enough blood supply. So this all causes bone loss as well. So there's so many factors that, we can, how they say, back in the day where I can't really remember the phrase exactly, but, your mouth is the mirror of your overall health. it shows you everything.
I've never heard it, but I believe you 100%.
Yeah, because it shows you like, you know, like what you have. It's the first thing that gets affected.
Mm-hmm.
So yeah,
it was also one of my questions, because we have one device and it has like UV light, and you have to put like mouthwash, and it has green color, and then the light is somehow working better on that green colored teeth. And
what is it called?
Lumoral.
Which one? What is it? What kind of treatment?
So it's just the light,
okay.
UV light you put for 10 minutes, and it produces heat.
Okay.
And it's not whitening the teeth, but it's cleaning the bacteria, but like the bad ones. I can show you later.
Oh yeah, sure.
And it says that you can prevent diabetes or Alzheimer by doing this. So why? So
the thing is, in the oral cavity, you have good bacteria and you have bad bacteria. Okay? And Alzheimer's, Parkinson's, all of these diseases, and even heart disease, we're linking it with the oral cavity. So, for example, even a pregnant lady, if she's pregnant and she hasn't done like, you know, the proper oral hygiene and hasn't been to the dentist in a while, that's all bacteria seeping from the mouth, going into, let's say, the fetus. Mm-hmm. Okay? Making a premature baby, let's say. That's number one. Number two, it can cause Alzheimer's. It can cause so many other diseases. So because it's all linked. Other day, just I think a month ago or a month and a half ago, I had a patient who had unfortunately an open heart surgery just because his root canal wasn't done properly.
Wow.
Yeah. Bacteria, what it did is it degraded the atria of the heart, you know, the opening, the valve, and I think it was the mitral valve or something. So they had to do open heart surgery, and back then he was a teenager. So, for example, I had to treat him.
It was only because of the
it was teeth. Only because of the tooth.
I heard one story from one guy where he was saying that he was living in US without insurance. At that time, I don't even think he was legally there at that time. That's a side story. And he had some tooth pain. Yeah. So he wasn't really paying attention and training through it anyway and just ignoring it. And then after a couple of years, maybe 5-6 years, he finally got it done. Okay. And when they opened it, basically his whole nerve was rotten. And I mean, the smell was terrible. Yeah. And also, basically, it was his own protein already consumed by the bacteria there, and it was going to the jaw to a point that they told him that he was very close to actually getting some
like an abscess, or cellulitis as well,
and like a blood poisoning, basically.
Of course, yeah. Other day I had another patient who came in. She couldn't open her mouth. She just came in screaming. Her eye was black. Then, I asked her, what's the issue? She's like, I can't open my mouth. I'm like, did someone, let's say, domestically abuse you? Did someone hit you on the eye or something like that? Maybe it caused pain. This is the first question that anyone would ask, right? We have to, right? And then it turned out no. She didn't. What they did for her, actually, unfortunately speaking, they did for her veneers, this very famous Hollywood smile that everyone's doing. And in not a good way. They didn't remove cavities that she already had. And of course, let's imagine I'm just going to use this, just this demonstration. Imagine you have a jar and you put some bacteria in it and then you close the jar. What will happen?
That's what happened to the guy. He had the tooth sealed from the top. Yeah. but inside it was working.
Inside, it's just working. So the same thing, that veneer, what it did, because they didn't remove the cavity, that veneer, it just closed it up. It's just acting like the lid of the jar. And then it just kept on eating. Okay. And that lady, she also said that her insurance expired and whatnot, etc. I'm like, honey, are you seriously thinking about insurance right now? Where this, like, give me a few days, because she didn't come to me immediately. She waited 2 weeks. And in that 2 weeks, her eye became black. And then that's when she felt that the situation was really serious. I'm like, honey, if you came to me another 2 weeks later, it would have already reached your brain, because there is a connection.
And when you say it would reach the brain,
definitely.
Like, what would reach the brain?
The bacteria.
The bacteria. And that would probably not be...
That can cause immediate death.
Oh. Wow. And it's like traveling through the bone?
Yeah, because there's an area here, okay, where, so we have in our face some spaces called fascial spaces. I think you guys know it, especially because this is kind of your field. Between, like, the sheets of the muscle, it doesn't exist right now. Unless there is an infection, it just opens up. So, for example, it can change from cellulitis, which is like a small swelling, and then all of a sudden, the patient's face is like this. This is in between the fascial spaces. Like, for example, let's see, these are the muscles, but you have muscles of the face, and this is like fascial spaces where it just opens up. Oh, wow. It fills up with bacteria. And there's only one connection that's like, goes straight directly to your brain. So this is another, so I know sometimes dentistry, it is a little bit tedious, because a lot of people, like, they don't take it into like so much care and consideration. They think, oh yeah, it's okay, what's the worst that's gonna happen? But like, even for me, I was right. But for me, I'm a dentist. I see, like, patients on a day-to-day basis. But like, for example, in these past 6 months, I saw cases where, like, I know I read about them, but I finally got to see them in real life. So this is why awareness is more important than anything. Prevention is more important than anything, So, yeah.
But it's not that much awareness around this. I think because I'm reading a lot, I know more. Also, I read about the teeth a lot. But it's not usual article in...
So that's the sad part in today's world, where... everything is about, especially with dentists, it's drill, fill, bill.
Okay.
Right? Yeah. So this is the concept that they're all going for. But in my opinion, this is just wrong on so many levels. We're like, we're here, we're educated to educate. We need to, like, raise this awareness. This basically, it teaches generations. It what do you call it? It saves people a lot of money. It saves people a lot of trauma. Like, for example, one day I got this really cool Swedish guy, like, he had like tattoos everywhere. He's really like really well built up and everything. And like, he can't even walk through the door because he's so big. But, when he sees the dental chair, he turns like a little teddy bear. Like, there's no way I'm sitting on this chair, because he's had trauma. Yeah. So what I believe is, we as dentists need to make, society aware that, hey, it's not all that bad, It's something that this is why I like doing, the hygiene as well. I mean, of course, I can hire a hygienist, but that's not the point. The point is, like, I want to guide my patients step by step. I want to tell them that this is what needs to be done. This is what you have. You don't see it now, but you'll see it later. Like, for example, you don't see that you have a problem with bruxism. Come in 3 years down the line, you're going to ask me, why are my teeth chipped? I come to the dentist every 6 months. So this is something that I believe that, we should make these, like, people know, because a lot of people don't know. There are so many articles, so many reviews, so many case studies, like, especially right now that, with master programs as well, that universities are releasing. And this all, like, helps with education. I mean, of course, dentistry today is not the same as dentistry back then. We have, like, so many different things. I mean, first we're using brackets and wires. Now we're using a piece of plastic. So for example, as
with
well,
with calculation from AI.
Exactly, with artificial intelligence, exactly. So this is something that we have to take care of. Like I always tell patients and parents as well, like, hey, like bring in your children, even if like, it's their first tooth. This is when it's advised to tell the child to come in. Why? Just so that we can make them, even though we don't do anything at all, we just want them to like, to desensitize them, to show them this is a chair. This is normal that you're coming in. Even though we don't do anything, but slowly they get used to it so that they don't have that fear, they don't have that apprehension, So it is very important. Like, for example, if I see a child and the parents will be like, no, this is fine. I will treat her with orthodontics, like, with the normal braces later when she's 13. Well, the thing is, when she's 13 or he's 13, they've already crossed puberty and, the bone stops growing. So what we need to do is they need to go to the orthodontist. What if they had a skeletal issue? What if their lower jaw was too big in comparison to the upper jaw? They can give them an appliance and they can stop the growth of the lower jaw and make the upper jaw grow even further so it can be okay.
So you can shape it.
It. Otherwise, after they cross a certain age, they have to do surgery. And so why would a patient want to go through surgery? Or, so there's so many things that you can avoid by just coming in early, by just coming in for a checkup,
We have a couple of last minutes. So I'll ask you.
No worries.
You're talking like super nicely and very much into depth, which I like, but because you're limited on the time.
No worries.
Try to do like very short and direct answers if possible.
No problem.
Brushing, flossing, or this like Listerine thing. What is the best way to clean your teeth?
Brushing and flossing.
Brushing and flossing, both. Okay. Morning and evening.
Morning and evening. And nothing after you go to just before bed.
Just before bed. Yeah, of course, yeah. Just before dinner. And,
exactly. No, you do it after dinner, before bed.
Yeah, absolutely. Is there any food that I probably know the answers. Okay. However, from you, any food you want to 100% avoid?
Well, the thing is, all the good stuff are the bad stuff, no? Okay, so I can't go tell people, hey, don't eat this.
No, we do it here. We tell people. It's up to them if they do it.
It's up to them, yeah, exactly. But most common misconception, everybody thinks it's always candy. It's not. It's chips and carbs. Because your saliva has enzymes, so it breaks it down to an immediate sugar. And that's why due to chips and due to carbs, children get more cavities than when their parents give them chocolate and candy.
Okay, so chips and carbs.
Carbs like bread, chips, all these things.
So these are way worse than actual candies.
Well, on the same level, let's say. On the same level. But because parents are not aware, right? So they think that, oh, hey, the sandwich is better for you than this chocolate, But they're almost the same.
What about whitening?
Okay. What about it?
Yes, no, why?
Yes, why not? But not over excessively. Okay. Everything in moderation is good. Everything being excessive is not good.
What would be that for whitening? Like how often?
So on average, what I recommend for my patients is if they want to, there's two different types. If they want to do the professional chairside whitening, they should just do it once. And then if they want to do the retouch, they can just do home whitening. Okay. So they don't have to repetitively, continuously do. That's just really bad for you. You just do it once. You're good to go. You've already whitened the internal tooth structure. So all you need to do to maintain it is do home whitening. But just a few applications and that's it. You're good to go.
Home whitening would look like you have some special paste.
So you get like a bleaching tray and then you put a small drop, but because it's like a vacuum bleaching tray, one drop goes a long way.
Okay.
Yeah, so it just spreads over the front surface of the tooth. Yeah.
Tima already touched on this one, the UV light you put into your mouth. Does it work? Is it good?
For whitening?
No, generally, for whatever the purpose is.
So this thing, I have never heard of it. But I understand the concept, because with that light, you can kill bacteria, but I don't know exactly how effective it is. I'm sure that they have carried out studies, but I personally haven't read them. Yeah.
Oh, sure.
So, but then, exactly. I'd love to see as well. But probably it does.
Okay. And I think that's we touched on everything what I wanted.
Maybe I have one more, but I don't know if it's short.
No, go ahead.
Question is about amalgam filling.
Yes.
Just your insight.
So there's always two schools.
Yeah.
Okay. They teach us as students that, how to do the conventional preparation of a cavity and put in amalgam. Until today, they are doing amalgam. However, I'm not a fan. Reason is, even though they show you so many studies saying that it doesn't affect you, it will not cause Alzheimer's, it will not cause, etc., all these diseases or poisoning. In my opinion, okay, I think on the contrary, I don't think that we need to have them anymore. Number one, we have evolved technology in terms of technology studies, all of that. We were able to make composite that is hard enough to withstand forces of the mouth. Mm-hmm. Before, why did they use metal? Is because the composite wasn't developed yet. Now they have fillers, now they have nanoparticles, now they have so many different things to affect the polishability, to affect the strength, to affect the tensile forces, to affect the stress forces, so many different things. So I don't see the point of doing it. Plus, with amalgam fillings, there's a lot of it's called micro leakage. So amalgam, what happens is over time, okay, they shrink. Mm-hmm, mm-hmm. When they shrink, saliva and bacteria seeps underneath the amalgam filling. So we know when we open up an amalgam filling, it's like we're opening up Pandora's box. Yeah.
You never know what you found.
So yeah, we will find stuff on the inside, and it most likely ends up as root canal, not all of the time.
It happened to me.
Yeah. So. Okay. So this is because it just shrinks, everything seeps underneath, and then that bacteria is just eating and corroding away the tissue, and that's what happens. It's too late and it's already in the nerve. So then you have to do a root canal and probably an onlay, or a crown, depending on how much tooth destruction there is. Mm-hmm. So yeah.
So it's better to remove, maybe.
So also what I would suggest is it's always good to take x-rays and see if there's anything underneath. Mm-hmm. Okay? If you feel like it is shallow, okay, it is better to remove it and put a composite filling. Yeah. However, if you see from the x-ray that it's exactly next to the nerve, why should you remove it? Just leave it until it happens, and then you just have to do the root canal. Otherwise, we are intentionally causing the root canal. Yeah. So yeah.
Oh, you said so much in this short time.
Sorry, guys.
No, that's good. I want to thank you for that. Do you have any message to the end?
My message to everyone is don't take it so lightly. Really, we're not as bad as everybody seems, as everyone makes it seem. Prevention is better than cure. We're here to help. My office is always open. If anybody has any questions, they can ask me directly, on Instagram, please feel free. And I do it because I love it. I love patient education. I'm sure that you guys, when you do the stuff that you do it because you want to do it. Otherwise, you won't do it at all, right? Yes. So yeah, I believe prevention is better than restoring, even though my job is to restore, but I make it a lot easier for me.
But you're doing also a great job in educating people.
Yeah, thank you.
When Tima actually booked me the session with you, right? And I really okay, I'll just go, I wasn't super excited, but I left. She was waiting downstairs by the Miracle Gardens, right? Yeah. And she picked me up and I was like, I'm definitely going back. This was very cool. And because I'm a type of person, I need to know the why behind it. Yeah. And you provided it.
Of course, yeah.
You always explained.
Because it's every patient's right to know why. I can't tell you, oh, hey, let's do this, but you don't know what's the reason. You have to have, for example, if there's a treatment as well, I have to show you that, listen, it's not just one treatment option. You have treatment A, you have treatment B, you have treatment C. For example, some people can afford certain treatments, some people can't. Some people, are willing to go and through this length of treatment, some people can't. So, we always give, what's the best solution. At the same time, if I feel that there is something, like if the patient wants me to do something where it's wrong, I tell them, please, like, go find someone else. Like, you know, like I get on a daily basis, hey, I want to do veneers, and their teeth are gorgeous. You know, I'm like, do you know what you can do after? Yes, I love veneers. So I'm an aesthetic dentist and I do place veneers, but I place on veneers on people to improve their quality of life, to improve their smile, to improve their confidence, but only when there is nothing left. You know, that's why I like to use Invisalign, because it's minimally invasive. I like to use veneers on people and to change their smile when I feel like there is no other way.
So this is like last resort.
This is the last resort when, you know, for example, some people, they have completely healthy teeth, but the shapes of their teeth, it's like too small, or the shape is not like, you know, like perfect, especially like, let's say the right with the left. Or yeah, of course they need veneers. I will be the one to tell them, yeah, you do need, because it will enhance their quality of life, their confidence levels and everything. You know, first thing people notice, I think you guys seen this picture that went like, you know, viral. A person with no eyebrow and a person without a tooth, right? What's the first thing you're going to notice? Is a person without the tooth. They're not going to focus on this one, right? So it is the first thing that, you know, people see, whether it's a job interview, whether it's people who are dating. It's the first thing that you see. Like, you know, when, like, you know, you're talking to her, she's talking to you. It's the first thing that, you know, it's our form of communication, because how else? I mean, our COVID times have us with the mask on, right? But, you know, a lot of people are seeking treatment right now because there's a mask. So they're doing, whether it's like Invisalign or they're doing their treatment, because, you know, they don't really have to, like, you know, worry about, like, you know, going out, you know, in the public because they're wearing a mask on. But then anyways, it's just going to be for like a few weeks.
Yeah.
Bless you.
Thank you. Yeah, it is not going to last forever. Yeah. Cool. Thank you very much.
Thank you very much for having me.
Definitely. If you'll find some other time, we can continue.
Yeah, definitely. We can continue in another episode if you'd like.
Yes, absolutely.
Yeah.
Yes.
Maybe we can do like something else as well. Yeah.
Cool. Anything you will bring to the table.
All right.
Thank you so much.
Thank you so much, guys. Thank you.